Prediabetes is a condition that serves as a warning sign for the onset of type 2 diabetes. It indicates that your blood sugar levels are higher than normal, but not yet high enough to be classified as type 2 diabetes. The term prediabetes can be somewhat misleading, as it suggests an inevitable progression to diabetes. But in reality, with the right lifestyle changes, and in some cases, medication, you can turn things around and potentially totally prevent or delay the onset of type 2 diabetes. To understand prediabetes, we need to talk about how your body handles sugar. When you eat, your body breaks down carbohydrates into glucose, or sugar, which enters your bloodstream. In response, your pancreas releases insulin, which is a hormone that helps your cells absorb this glucose for energy. In prediabetes, your cells become less responsive to insulin, which is a condition called insulin resistance. As a result, glucose starts to build up in your blood because your cells aren't absorbing it efficiently. Think of insulin as a key that unlocks your cells to let glucose in. In prediabetes, it's like the locks on your cells are starting to get a bit rusty. The key, which is insulin, still works, but it doesn't turn as smoothly as it should. Your pancreas tries to compensate by producing more insulin, but over time, it may not be able to keep up with the demand. Prediabetes is incredibly common, much more so than many people realize. In the United States alone, the Centers for Disease Control and Prevention estimates that about 96 million adults, which is more than 1 in 3 adults, have prediabetes. What's even more alarming is that more than 80% of those with prediabetes don't know they have it. Globally, the International Diabetes Federation estimates that 541 million adults had prediabetes in 2021, a number that's expected to rise to 730 million by 2045. Causes of prediabetes. The causes of prediabetes are complex and often interrelated. One of the primary risk factors is being overweight or obese, especially if you carry excess weight around your midsection. This type of fat, known as visceral fat, is particularly harmful because it produces hormones and other chemicals that can make your body more resistant to insulin. Lack of physical activity is another significant factor. When you're sedentary, your muscles use less glucose, which means more stays in your bloodstream. Regular exercise helps your cells become more sensitive to insulin, allowing them to use glucose more effectively. Diet plays a crucial role too. Consuming too many calories, especially from foods high in sugar and refined carbohydrates, can lead to weight gain and spikes in blood sugar levels. Over time, this can contribute to insulin resistance. Age is also a factor, as the risk of prediabetes increases as you get older, particularly after age 45. This might be due to a combination of factors, including a tendency to become less active and gain weight as we age, as well as natural changes in how our bodies process glucose. Genetics can play a role as well. If you have a family history of type 2 diabetes, you're at higher risk of developing prediabetes. Other than that, hormonal changes can also contribute to prediabetes. For example, women with polycystic ovary syndrome are more likely to develop insulin resistance and prediabetes. Additionally, certain medical conditions, such as sleep apnea and high blood pressure, are associated with an increased risk of prediabetes. Symptoms of prediabetes. One of the trickiest aspects of prediabetes is that it often doesn't cause any noticeable symptoms. This is why it's often called a silent condition. Many people with prediabetes feel perfectly fine and have no idea that their blood sugar levels are elevated. However, some individuals may experience subtle changes that could be indicators of prediabetes. One common symptom is increased thirst. You might find yourself reaching for water more often than usual, feeling like your mouth is dry even when you've been drinking regularly. As glucose builds up more in your bloodstream, your body tries to flush it out, leading to another common symptom, which is frequent urination. You may notice that you're making more trips to the bathroom, especially at night. Fatigue is another potential sign of prediabetes. Even if you're getting enough sleep, you might feel tired more often than usual. This tiredness can be due to your cells not getting the energy they need from glucose, as insulin resistance makes it harder for glucose to enter your cells. Some people with prediabetes experience blurred vision. This occurs because high blood sugar levels can cause the lens in your eye to swell slightly, affecting your ability to focus clearly. This symptom may come and go as your blood sugar levels fluctuate. Slow healing wounds can be another indicator. If you notice that cuts, scrapes, or bruises are taking longer to heal than they used to, it could be a sign of prediabetes. This is because elevated blood sugar can interfere with your body's natural healing processes, making recovery slower. In some cases, people with prediabetes develop a skin condition called acanthosis nigricans. This appears as dark, velvety patches of skin, typically in body folds and creases like the neck, armpits, or groin. While not everyone with prediabetes develops this, its presence can be a sign of insulin resistance. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of prediabetes. Diagnosing prediabetes involves blood tests that measure your blood glucose levels. There are three main tests used. Number 1, the fasting plasma glucose test. This measures your blood sugar after an overnight fast, or not eating for at least 8 hours. A result between 100 and 125 milligrams per deciliter is considered prediabetes. Number 2, the oral glucose tolerance test, OGTT. This test involves drinking a sweet liquid containing glucose, then having your blood sugar measured 2 hours later. A result between 140 and 199 milligrams per deciliter indicates prediabetes. Number 3, the hemoglobin A1C test, also known as the A1C test. This is a test that measures your average blood sugar level over the past 2 to 3 months. An A1C level between 5.7% and 6.4% is considered prediabetes. Your doctor might use one or more of these tests to diagnose prediabetes. If your results are in the prediabetes range, your doctor will likely recommend retesting every 1 to 2 years to monitor your levels. Treatment for prediabetes. The good news about prediabetes is that it's reversible. With the right approach, you can bring your blood sugar levels back to normal and significantly reduce your risk of developing type 2 diabetes. The primary treatment for prediabetes involves lifestyle changes. Weight loss is often the first line of defense. Losing even a modest amount of weight, 5% to 7% of your body weight, can make a big difference. For someone weighing 200 pounds, that's just 10 to 14 pounds. Regular physical activity is crucial. Aim for at least 150 minutes of moderate intensity exercise per week. This could be brisk walking, swimming, cycling, or any activity that gets your heart rate up. Exercise helps your cells become more sensitive to insulin, allowing them to use glucose more effectively. Dietary changes are also important. Focus on eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. You should also limit your intake of sugary foods and drinks, as well as refined carbohydrates. Portion control is also key here. Even healthy foods can contribute to weight gain if you eat too much of them. If you're a smoker, quitting can also help. Smoking has been linked to insulin resistance and an increased risk of type 2 diabetes. In some cases, your doctor might recommend medication to help manage your blood sugar levels. Metformin, which is a drug commonly used to treat type 2 diabetes, is sometimes prescribed for people with prediabetes who are at high risk of developing diabetes, such as those with a BMI of 35 or higher, women with a history of gestational diabetes, or individuals with very high fasting blood sugar levels. Metformin works by reducing the amount of glucose produced by the liver and improving the body's sensitivity to insulin. While it can be an effective tool in managing prediabetes, it is not a substitute for lifestyle changes, which remain the cornerstone of treatment. Regular checkups with your healthcare provider are important to monitor your progress and adjust your treatment plan if needed. Your doctor might recommend more frequent blood sugar testing, especially if you're at high risk of developing type 2 diabetes. It's important to note that treating prediabetes isn't just about preventing diabetes, it's about improving your overall health. The lifestyle changes recommended for prediabetes can also help reduce your risk of heart disease, stroke, and other health problems. Now, we want to hear from you. Do you or someone you know have prediabetes? What lifestyle changes worked for you before? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.